Hello, Bio54. My name is Krista, and I will be talking about skin cancer. Okay, so first I want to go over some background about skin cancer. It is the most common form of cancer. It forms when new cells are created but not needed, or when damaged cells don't die. Both of these situations create a mass buildup of tissue, which results in a tumor. So there are three types of skin cancer. These include squamous cell carcinoma, basal cell carcinoma, and melanoma. So the first two, squamous cell carcinoma and basal cell carcinoma, are actually non-melanoma. What does that mean, right? So melanoma actually spreads to other parts of the body, whereas non-melanoma doesn't really spread. Melanoma also is the rarest form of skin cancer, so most likely we would see squamous cell carcinoma or basal cell carcinoma before we would see melanoma case. So all skin cancers can occur anywhere in the body, but some of the common areas that we mostly see cases are in the face, neck, hands, and arms. So what are some of the risk factors for skin cancer? These are sunlight, UV rays, the use of tanning beds, any medications that you are taking that increases skin sensitivity, any prior sunburns that were really severe, or even skin color. The lighter the skin you have, the more at risk you are for getting this cancer. And then lastly, family history. So if a relative has had this cancer in the past, you may be at risk. Alright, so now we're going to talk about some of the symptoms. So skin cancer has a few symptoms. The change in appearance of an existing mole you have is definitely something that would be a sign. But how do we look for these, right? So here's an acronym for what to look for. It is A, B, C, D, E. So first is asymmetry. So this is like the shape of one part of the mole doesn't match the other part. So if you see in the top picture here, we have a brownish area at the top, and then a kind of black dark spot towards the bottom, and the gray pigment to the left. They're not symmetrical on any of the sides, so the brown and the black, they're not symmetrical at all. So that's kind of the asymmetry we're looking for. B, border. This is the edges of the mole. They're kind of ragged, and the pigment kind of can permeate into the skin and not be totally with the mole. It can be kind of around the mole. So for example, again, in the top picture, there's that grayish area. That would be where the pigment would have permeated into the skin around the mole. Then next we have color. So C, different shade pigments may be seen. Some colors, aside from the gray that we've already pointed out in the top picture, include white, red, pink, and blue. So next we have D, diameter, the change in size. So usually our moles will stay the same size, but if they do like grow in size, that's definitely a sign that you would want to get it checked out. Then lastly, E, evolving. So any general changes in the mole would definitely be something, a sign that says, hey, like, this is different. We should look more into this. And then a bleeding surface that is bumpy or painful. So like in the bottom picture, it has a lump that has bleeding and there's a crust around it. So that's something to look for. Some more symptoms include, one study found that actually the most common symptoms for non-melanoma skin cancers is itchiness, but also change in skin. So any, differences. We kind of talked about the size changing or the color. So definitely looking for that. Any new growth. So say you find a mole that you haven't seen before, definitely get that checked out because it's, it's a new mole. Then any sores that won't heal. So usually when we get a sore, over time it will heal itself and then it kind of disappears. But if it's not disappearing, there's probably something wrong. And then lastly, lumps that are small, smooth, shiny, or firm. They can be firm and red, or they can be flat and a red spot, and they're usually rough or dry. And an example is to the right, that picture of a lump that one may see. And if you do, please get it checked out. Okay, so now we're going to go on to treatments. So there are a variety of treatment options. First of all, though, oncologists will determine the stage of skin cancer the patient is in, because they're not going to want to prescribe anything that isn't going to be helpful. So in the early stages of skin cancer, those early stages can be treated with surgery or vaccines. The problem with vaccines in later stages is they're not as effective because the cancer cells have already started to attack and prevent the immune system from fighting back. But so those are the early stages treatments, but for more advanced stages, they require more aggressive treatments. So, for example, immunotherapy is something that is a treatment that can be used for a more advanced stage. This helps with the patient's immune system, and it helps their immune system fight against the skin cancer cells. So usually when we hear of therapies, we hear of chemotherapy. So chemotherapy is where a major agent in that is cytotoxic drugs. And those cytotoxic drugs, they're used to prevent the cancer cells from multiplying and spreading, but they also destroy the healthy cells along with the cancer cells. So in kind of trying to get away from destroying healthy cells, immunotherapy has targeted drug therapy. This type of treatment, they target the cancer cells that have certain characteristics and try to get rid of those. This treatment targets those cells and removes the cancerous cells and removes them, and this improves the cure rates, and it minimizes the toxicity from the more generalized treatments. And then lastly, we have adoptive cell therapy. This introduces a tumor infiltrating lymphocytes, and it helps minimize the size of the tumors and potentially can allow for higher survival rates in patients. But, however, more research is definitely needed. So lastly, I'm going to go into some current news. So I'm going to talk mostly about the prevention of skin cancer. One study was conducted that, showed mobile phones like having apps, texts, or reminders that, would help prevent people from staying in the sun too long and help spread the awareness about skin cancer. This study was very positive. It had positive effects. The people were more prone to coming inside and staying, more indoors than outdoors when they got those reminders saying, hey, you've been in the sun too long, maybe you should go back inside. So that's one way that they're working on improving prevention rates. And then also another way is yearly body examinations. So right now we have the mammograms for women pretty regularly, and that's to detect the breast cancer. And so why not for skin cancer, right? So these are not required, obviously, now because we don't have yearly body examination requirements, but it could be in the future to prevent more of the serious cases of skin cancer. Because if they catch the early stages of skin cancer now, then they won't have to deal with the extreme cases in the future. They'll get it right before anything major happens. And I want to just leave you guys with a saying that was created by the Anti-Cancer Council of Australia. It is, slip on a shirt, slap on some sunscreen, and slap on a hat. It's just a gentle reminder to, make sure that you're covered when you go outside and not stay out in the sun too long, and just be aware that the UV rays do have an effect on your skin. So I hope you enjoyed this presentation.